before we get into the program, tell me Lorelai can provide us with the land acknowledgement.
Okay, so this is our house. We're going to share some teachings that go along with it. So Matt is coming up to witness. And the reason he's getting picked up is he is ex officio on our board of RayCam, the community board, but he's also part of the Richard program. So he is witnessing an apprenticeship that we actually work together. Just in case other people want to learn that. And then Penny is coming forward from our board, and she's been a witness how we as a board work together for the community's needs. So, and I have a spare plate, just so that you know, the spare plate is to honor our ancestors. Afterwards, you're more than welcome. That's our ED coming in at the right timing, just invisible string. And the spare plate is to honor our ancestors. You don't hear that in our opening comments, and they can eat whatever you like to eat. Right? Okay. So I hold my hands up to each and every one of you. Thank you so much for being here, especially those that are on the Zoom. I give thanks to you for being here and asking you to connect your minds to your hearts and undertaking the discussion in good, kind, gentle ways and good, kind, gentle words, but also looking to decisions that will affect future generations. I give thanks to our relatives for looking after us so well each and every day on their unceded traditional territorial land. Musqueam, Wamish, loyalty. And I give thanks to all the Mother Earth's messengers that walk across our path and ask that we pay attention to those messages. I want gently on Mother Earth because she needs all the help that she can get. She's putting out very clear messages, so let's pay attention. I give thanks to our ancestors for being here with us, because without their wisdom, we would not be here today. And that's all of our ancestors, all of our indigenous knowledge of all of our backgrounds of ancient times. What I gotta say, widow, all my relation.
Hi everyone. My name is Quay. I'm the research manager with UBC Health. So I'm just here today to share a little bit of background about the Health After 2020 program and also introduce the group that's going to be speaking to you. So I guess to start off, I'd like to make a few comments about the what UBC Health is, if anyone's not familiar. So our unit is an administrative unit at the university. We work under the office of the Vice President of Health. And so we recognize the growing need for collaborations that address the complex and interconnected problems that are facing society. Our unit works to facilitate collaborations across disciplines, faculties, and campuses, as well as with health partners and communities. And so our work enables us to improve the ways that we collectively train people, develop knowledge, and shape policy, with the ultimate goal of addressing inequities and improving the systems that support and foster health. So through our initiatives, we aim to support an active community of health research practice and mentorship, bring together scholars, students, and community partners, and discuss important topics related to the health and well-being of society. And so, as we all know, our understanding of the determinants and experiences of health have changed so much since 2020 and the COVID pandemic. It's accelerated some existing trends and put spotlights on new ones. And we're continuing to address the broad effects of the pandemic every day. And so we have the opportunity to learn from our collective experience, as well as to think differently about how we define and value health, how we understand the complex systems that produce health, and how we rise to the challenge of supporting equity across individuals, communities, and societies. And so in response to this opportunity, UBC Health developed the Health After 2020 program. This was designed to support researchers to engage in interdisciplinary collaborations and build a community of UBC Health scholars. And so through the development of research collaborations, cross-campus collaborations, and open dialogue sessions like the one you're going to participate in today, the program convenes and informs people at the inflection point in our society created by the COVID pandemic. So far, this program has supported 15 interdisciplinary teams to disseminate their collaborative research and engage with the broader community through dialogue sessions. And as we progress beyond the acute stage of the pandemic, we're committed to moving forward together with a focus on facilitating collaborations that emphasize community engagement, innovation and knowledge translation, and capacity building in that area as well. And so in our next iteration of this program, we partnered with the UBC Knowledge Exchange Unit. That application period just closed last night. So we're looking forward to seeing what we get in that new flood of teams that are applying. And so we're proud to support today's session, which will include academic and community perspectives on ways that COVID has impacted opportunities for early years development and well-being. You'll hear more from the UBC Health scholars and project team members shortly, and we're excited to see dialogue sessions move back to the hybrid and in-person formats. Many of them, because of the pandemic, had to be held online, and I think we're all probably familiar with how valuable it is to have the in-person connection. So again, UBC Health is really happy to support today, and I'm really looking forward to hearing from all the speakers. If anyone has questions about UBC Health or the Health Under 2020 program, I'm happy to stay around and chat, and I'll hand it back to Matt.
Everyone on Zoom. It's really very lovely to be here, geographically as well as socially in person. So we've dreamed up this title about whether child development is still the greatest equalizer, because some of you may be familiar, but over about 15 years ago, Quay, who was the founder of Humanitarian Learning Partnership, which is the unit that's engaged in UBC that many of us come from today, co-authored this report for the early child development and powerful equalizer. So the thesis was that dating forward based already on building evidence was that investing in improving early childhood context and outcomes makes sense from both developmental perspective, because early development sets the building blocks for later more complex development, more complex skills, both emotional and cognitive, but also economic perspective. Even by 2007, there was quite a lot of work showing that investment, monetary investment in the early years, is actually the one that brings the biggest benefit. So bang for the buck, I think, right? But we also know that early child development is not just about the child themselves. No? It's about brain development, but not about child alone. It's also children will shape the environments that they grow up in. Family, residential community, relational communities, that means not geographic, the ones that they come through their heart, but also regional and national programs and policies. So when we, are putting this proposal together, this bill will hold true after we come out of the pandemic, and we're only emerging from the pandemic, but we can ask this question again. So how do we know how young children are doing? And in order to do that, especially when you look at the impact of the pandemic, one of the best ways is to use the data that were available for children, the type of data that were available for children before the pandemic, and then compare them with those after. And so we are at Hope and at McMaster University, which is my other home. We are in a lucky position that we've been collecting data on early child development using the early development instrument for quite a number of years. And EDI, or early development instrument, is a kindergarten teacher completed tool to measure child development at school entry in 5 developmental domains: physical health and well-being, social competence, emotional maturity, language and cognitive development, and communication skills and general knowledge. I'm not going to go into details. There's some websites. Oh, actually, you can't see the website, but there's 2 websites there. We will share but all I'm saying here is that we collected data prior to the pandemic on almost 1.5 million children, and so we have data to compare with the data collected post-pandemic also. Based on the data that we've already had, we knew that there are inequities in early child development. The early development instrument data are particularly good in highlighting what we call gradients in social, in development in relation to income and socioeconomic status. So here are data from BC in 3 waves of EDI data collection. Okay, we're going to try this. So what you can see is that proportionally, the poorest, the highest vulnerability in early development happens in the lowest socioeconomic income neighborhoods. Similar things happen in other countries where the similar data were collected. The degree of inequity depends on the place, depends on the province, depends on the country. As you can see here, the pattern is the same, but the difference between those who do poorest and best is a little bit different. We also know that boys, males do worse on in early developmental stages than girls. We know that children coming from Indian background originally tend to do a little bit worse, but these differences sometimes even out as children go to school. What we're not very good at showing in terms of data, we know it anecdotally, is that there are big differences also in terms of racial differences, but we don't have Canadian data to show that yet. So what is our concern about the difference between pre and post-pandemic onset? Well, the data that I'm going to show you comes mostly, it was mostly collected on children who were born in 2017. So this is not like school closures that we are concerned about. This is really a reflection of the social isolation and differences in terms of where, how did the children's interaction look like? In some cases, I don't know whether you still remember, I didn't have young children at the time, but you couldn't even take them to the playground. That's the panacea for any parental distress is take them outside, take them to the playground, and you couldn't do that in the first months of the pandemic. So we're not really necessarily concerned about the educational outcomes of those children. It's really more socioeconomic. And guess what? So I'll show you here. So we've had a number of provinces and jurisdictions in Canada that had close pre-pandemic data and then post-pandemic. In Quebec, post-pandemic data were collected in 2022. In the red provinces, so that's Ontario, Manitoba, PI, Newfoundland, and Labrador, Nova Scotia, Northwest Territories in 2023, spring this year, and in BC data were collected both in 2022 and 2023.
Just so that I'm clear, the data around pre and post COVID pandemic are collected in different areas. So you might have a lot of pre data in one area, and then in another province, you have a lot of pre data on something else.
No, it's the same type of, the same questionnaire. So okay. kindergarten teachers complete the same questionnaire on every child in their classroom. And when we compare, it's based in the same space. Yeah. Okay. That's an excellent question. And you know, this is a very very broad. Like we really haven't had time to go into this very deep. So this first graph shows you that the brown is pre-pandemic, turquoise is post-pandemic for all the provinces except for BC. So it's really a massive kind of big pot. But it includes Ontario, it includes PI, it includes Manitoba, right? And what you can see, the differences aren't big, but the vulnerability. So if it's higher, it's worse. Basically, that's the problem. So you can see that the results are a little bit worse in every area of development, but the worst are for emotional maturity. So children are more anxious, a little bit more aggressive, maybe more hyperactive, and they show less for social media. Now we're adding BC to the data, and so it's kind of the same color, but just not as dense. And what you can see is, yes, the same trend shows like the post-pandemic data are also showing higher vulnerability. But you can also see that BC started from a higher level. So the levels of vulnerability, and we're not going to have time today to get into the details, but maybe just a tiny bit. But unfortunately, BC started from the worse one altogether than other provinces. The final piece of information that I'd like to share is the perception of what the educators think about what the children in their classrooms are, how the children develop, and before and after. So what we did in Ontario, we've asked kindergarten and primary teachers, so both grade 1 and grade 2, and then divided the data. And what we can see here, the purple bars are higher than the red, which means that the teachers of children in 1st and 2nd grade had more concerns about every single area of skills, academic, overall, physical, and socio-emotional, than kindergarten. But that doesn't mean that kindergarten teachers did not have concerns. So the bar shows percentages of teachers who had at least some concerns. So all of them pretty much had been worried. But again, if we add BC data to the mix, that's the gray bar. These are only kindergarten teachers, so they're really similar to our Ontario teachers, but it's less worried. So there's a lot to unpack here. And finally, so what I would like to end and open it up for my colleagues to continue is basically, I have no answer to this. We just have next steps. But I think what we really know, we kind of know the direction where we need to go. Like pandemic didn't last just, like the 1 day, 1 year. It's something insidious that continues to exert its influence. And we actually, at this point, we do have quite a lot of data that we can explore, especially for differences in known groups, in known neighborhoods, that we knew that things weren't going all that well. We know that some neighborhoods were much more affected by various things that could have been compounded by pandemic. So this is the direction that we're going to take after this year of reflection and looking at data. However, in answer to this question, the thesis that Kai Carson put 20 odd years ago, is that it appears that investing in young children's actually is even more imperative because of where these slight differences, and when you think that slight differences maybe don't look so big, but if you translate it into the thousands of children that probably reflects, these are huge differences. And we just can't let them go. So to be continued, and I'm going to pass it on to Rabia.
I'm going to say that, and I hope everyone will be able to do somewhat because I find that the more I stand or the more I move, the louder I get. I won't be able to handle that. So I don't be all around because it's too much. I'll just while I just wait for the slides to load. So my name is Rabia. I think half of the people in this room would really be surprised to see me because I'm usually there running around doing things in the center. As one of the daycare kids asked me, why am I dressed nice today? And I was like, please don't say that. So this is the as good as it gets. So my title at RayCam is Childcare Analyst. Yeah, and I think this what I'm going to speak about is probably a summary of my own understanding on the journey of what is the role of early childhood education and care in education, health equity, and public policy. You can ignore the slides right now until we get to the main one. I think as a social scientist, our dream is that if you accurately name or describe a problem, it'll help you prescribe a solution to it. And that definitely hasn't worked in the early childhood and education sphere. Can I?
Yes, you're good.
Okay. So Hospital actually coined this term a wicked problem in 1967. So, and I'm paraphrasing the way the problem was described. It's a class of social system problems which are ill-formulated, where the information is confusing, where there are many clients and decision makers with conflicting values, and where the ramifications in the whole system are thoroughly confusing. I don't think I found a better definition to describe the early childhood education industry in BC than that. So that's what a wicked problem is.
All right, just kind of study your way.
Okay, so why do we, so I think Magdalena painted a
a macro Canadian picture, and I'm going to zoom in into where we're sitting right now. So why do we need early childhood education and care? This is probably, so, and I know, I don't know if people in Zoom can see me pointing, but the reason that comes up the most in policy discussions is parents, especially mothers, can work. And the most quoted statistic that you keep on hearing is that Quebec has the largest percentage of working women, of working moms, especially moms of young children. And that's what comes up over and over again. And what shows on the other end of the slide is basically who the government literally say that are reasons for education. This is not something I'm hypothetical or paraphrasing. If you were to fill out a form as a parent or a caregiver and apply for affordable childcare benefit, so now we're getting into the nitty-gritty practical stuff of accessibility to childcare, you can only select two of them. Well, you can select either you're employed or looking for employment, you're studying, or you have a medical condition. Those are the only things you can select. The only way you can apply and not be working or have a medical condition is if your file resides with the Child Protection Service with social worker. Those are the only reasons why. So I know I think the disconnect I do want to show in these slides is theoretically, hopefully ethically, intellectually, and at the larger level, we understand why early childhood education should serve as a health intervention and to improve school readiness. But there's a disconnect in how it is being currently rolled out in BC. So, one, why do we need it? We kind of need it for the parents. We don't talk about needing it for the, I know all the community people are like, yeah. So one, it's not child-centric. Everything Magdalena said was child-centric, except when you come into policy and public finance, and then it becomes parent-centric. This is the parent profile. The parent profile for these programs is usually educated, trained somewhat to be able to enter the labor force. Their kids are coming from a stable household. The family's proficient in English and French, because boy oh boy, there are a lot of forms to fill out in English or French. And there's an intrinsic trust of educational and health professionals. And there's administrative literacy. I'm not even sure if the dad knew before I put my children on a wait list for daycare. Putting kids on wait lists is an administrative literacy we cannot expect every single person to have. Again, I feel like there's a divide in the community for like, yes. But this is the profile our public policies geared towards. Now, before I talk about the other side, the early development instrument data that we were just discussing, the data from Strathcona, the neighborhood you're currently residing in, was suppressed because there weren't even enough respondents. So yes, BC is more vulnerable, but you're not even counting where you're from. So just to give you the kind of children that you will soon hear, yeah, it's 2:30, you guys got a couple minutes, running around the center, because after school's gonna kick in. So this is the data of children who were with us in daycare and early childhood, in daycare and out of school programs at RayCam from 2017 to 2021. So we had 127 children, and Guhn over there and Matt were very helpful looking through richer records to help figure out what are the health challenges our children have faced. Again, if you look at any other childcare institutions or the vast average of it, the percentage of children that are part of the inclusive agenda are not going to be at this level. So if you look at 127 names were given, of which 116 the richer pediatric clinics had interacted with, and we have 138 diagnoses. And you can see what it said. 30% had child protection services involvement, and 61% had social complexities at home. Social complexities, I think, is just I don't know, a nicer way of saying ACE, adverse childhood experiences at a higher level. So this is as of the end of October. Active social worker involvement, and again, this is social worker not for special needs, social worker involvement in child protection services. 39% in daycare, 55% in OSC. I mean, I would put this as an open challenge. Most daycares and after school programs, barring, again, Grace sitting there, factory down the street, won't be able to say that the numbers are this high. Our eligible, so we are what the government will call $10 a day. So our fee for daycare is $200 a month. 85% of our families cannot pay that. 96% of our families cannot afford $140 per month for after school care. This is as of the end of our enrollment numbers at the end of this October. This is an indicator of income and income level. Half of our parents are roughly single parents. So this was taken downstairs. So while RayCam definitely doesn't have a solution to the early childhood education issue, we find ourselves with a few grounding principles. And you know, RayCam, the motto is center of a community, and yet children don't just come down to the side, depending what age you're in. Usually we've gone past the same, but as you can see, again, what's not part of policy discussions is in order to be child-centered and inclusive, there has to be an element of advocacy, there has to be an element of community building, capacity building, and for us, accountability back to the community. And you saw that as part of the witnessing is to keep ourselves just as accountable to the physical neighborhood around us. And so what are we doing? Currently, as some of you in the room, and looking particularly in that direction, we're undertaking a needs assessment survey, because we actually can't say that, like the larger data sets don't include this neighborhood. Focusing on, actually I should have written, focusing on low income families only in Strathcona, with children between 2.5 to 5 years. It's /modified /stolen check, which, you know, and the team have been really helpful. But I think where we are right now is, I think what I'm kind of predicting, Matt will also say, hey, there's no magic solution, and we understand that. So if this is a wicked problem, the idea can't be a static policy. The idea has to be experimental tweaking and going back to the people, most of whom are not in this room, to see if what we are claiming to do, we're actually doing. So I would take this opportunity on the behalf of RayCam, and hopefully the board can back me up on this, is we'd love to figure out if what we're trying to do here is working. So, you know, let's help in recruiting families, low-income families, making sure their voices are heard, analyzing data, then designing program and advocacy recommendations based on that data, because otherwise we could literally just toss it out the window. And then program evaluation, back to accountability. Did it work? Did it not work? And hopefully a rinse and repeat, because unless we keep doing this, a back and forth, a continuous dialogue, it's not any better than it's, you know, just a policy. So with that, I got something.
Also said, it's more comfortable this way, isn't it? Rabia. Perfect. So, thanks so much for having me. I think as I listen to Magdalena speak and Rabia speak, what I'm hoping to do is speak to why meetings like this are so important and why there has to be a coming together in terms of finding solutions. I have many privileges, but one of the greatest that I have is that I get to sort of have a foot in two worlds in many different environments. So I'm a pediatrician by training, so I work clinically, and I'm super fortunate to not just work in any situation or any community. I get to work in this community. So I've been working here for 6 years, and it's been one of my greatest privileges to work with a lot of the programs and children and families in this neighborhood. And then I also have a foot in the research world. So I spend some time hanging out with my colleagues at the Human Early Learning Partnership and thinking about these big problems. And I think what I'm hoping just to share today is that I think what I'm hoping can come from this session is more opportunities for us to meet together, share these big data sets, share these big problems, and then come together and find micro or community level solutions, because there's not going to be a one size fits all approach. So with one of my research hats, I'll share you about one thing that I was, to be honest, sort of tasked with thinking about. I think we're all a little bit sick of COVID, even though it's still here. But I know we're generally sick of thinking about it and talking about it. Anyways, I was tasked to think a lot about like, hey, as a pediatrician that sometimes works in the hospital, how did health trends change during the pandemic? Did trends change with the relative strictness of pandemic public health policies? One of the really interesting things that happened in Canada is that the level of what we would call stringency or strictness of public health measures varied a lot over the course of 3 years and by location. And we need to really understand how problems change so that we can start to think about what the solutions might be, both in terms of building back from the pandemic. And again, I hate to say it, but future pandemic preparedness is, I think, something that we're all going to be thinking a lot more about in the next little while. So I had the great fortune to be connected with a project called Pediatric Outcomes Improvement through coordination of research networks. It allows me to have a research manager that then helps us out down here, even though the money is for something else, which is actually what I'm talking about today. And I just want to credit some of my collaborators, Carolyn Bosch-Tan, Rabia, and Savannah Cote, that have really helped us pull together this data that I'm going to show you. But you can go to the next slide. I'm like,
Oh, sorry.
That's okay. So through this project, one thing that we thought would be interesting to do would be to try to look at the data from both emergency departments and hospitalizations for children 0 to 21, and compare what was happening, back in 2016 to what then happened during the pandemic from, March 2020 up until really, like, we updated until March 2023. And one of the unique things about our data set, and people are welcome to email me and ask for the data set, we can share it, that's the whole point, is that this is kind of boring research talk, but most data sets exclude Quebec because they have different data privacy rules. Because our project is based in Quebec, and Carolyn and Savannah are buddies with the Quebec folks at Ines, we actually have the Quebec data too, so it's a truly national picture kind of capture. And it's not super obvious from the graph here when you look at the data, but there certainly was, from where that blue line happened, a spike in a lot of mental health conditions, which we know were probably some of the main things that impacted children during the pandemic. And some of the things that we saw a particularly remarkable spike in are things like eating disorders, so specifically hospitalization for eating disorders really went up. Mood disorders and suicide and self-harm significantly went up, and anxiety really significantly went up. And then just as much as I think Magdalena and Rabia are both mentioning, the trend that we aren't seeing can be as concerning as the trend that we are seeing. For me as a pediatrician in this community and other settings, a really concerning trend is that when we look at our data for hospitalizations across all of Canada, hospitalizations, which includes unfortunately folks that die in hospital for substance-related harms, actually went down in our data, and that stands in stark contrast to the data that's coming out, for example, from our BC coroner that shows that overdose deaths in young people are actually continuing to increase, and in British Columbia are the leading cause of death for people that are 10 to 18. It's like a horrifying thing to think about that our society has failed young people so much. It's not young people making a choice, it's society failing those young people. So I just want to point out that sometimes it's the trends that we are not seeing that are as important to really understand as the trends that we are seeing. Jeremy's just going to do the slides for me.
Yeah, I'm happy to do that.
Thanks. So I guess the perspective that I bring from having, again, a foot in two different worlds is like, this data is super cool. I'm like a data nerd. I would happily sit on the computer and tip top and run analyses all day. But what I'm still aware of is that these big data need community-based solutions. One thing that I'm thinking a lot about right now as a pediatrician is there's this big movement towards what we call precision medicine. So like really honing in on, say, genetic factors about what is the perfect treatment for a certain person or a certain condition. I'm hoping that we can start to think about precision public health, precision population health, precision social medicine that can kind of really understand at a personal and community level what folks need in order to have healthy and meaningful recovery. We can keep going. So like I said, with our group, the stage that we're at right now, and I'm sharing this as a work in progress, is like we see these trends. And I didn't kind of say this explicitly, but interestingly, when we do our nerdy science kind of analyses and look at whether there was like a relationship between how strict pandemic measures were and how hospitalizations changed, there's actually a very strong relationship for some things, like such as eating disorders. So we see that like the strictness of public health measures in repeated ways cause subsequent ways of eating disorder admissions. It sort of does make sense intuitively, but hadn't really been necessarily proven scientifically. But I think what we're really aware of in our team is we have all this data, but I, as a like adult white guy, don't understand why a teenager had a high risk of hospitalization during pandemic public health measures. So what we're now doing as the second phase of this project, in addition to having data, is now actually we will be meeting with young people, again, fortunately from across the country, that had some of these experiences, and I'm trying to understand like, what would have made this better for you? What can we do better next time? And what do you need now moving forward to actually have meaningful recovery from this? I'm really trying to shift that lens, I think, as a physician, and apologies to the physicians on Zoom and in the room, although I don't really apologize. Oftentimes, we've been the ones saying, like, do this thing, this is the treatment. We're trying to shift that to like, what is your health knowledge about how you will heal from this? And can we then amplify those findings? We go to the next one. And so I think one of the reasons that we're here today is in recognition of the fact that, like, as a researcher, we, the global we, as a clinician, we, the global we, shouldn't be the ones that are establishing our quote unquote priorities and research and innovation and next steps. We need to understand the data, but then look at the data and share it with community folks and say, like, what are our priorities? What should be the priorities that we're studying as, you know, this is Health After 2020, moving through COVID, as we move into COVID endemicity, into this next phase of our lives with COVID, and into future pandemic preparedness. And I think my last slide that I'll just share is that, especially for community folks, I think one thing that's really important is that this is not a one-time event and a one-time conversation. And I'm hoping that, again, the global we as researchers and can commit, you know, in a more meaningful way to sustaining community engagement. And one small thing is we have a small amount of money now with folks at RayCam, which is really exciting to continue some of this work and have some of these conversations, and really hone in on what matters to the people living around here, not the people that are coming here to work, and not people that are especially coming here to study or to do practice, right? Where we go next. So I will leave it there, sort of like Magdalena and Rabia, more questions than answers, which I think is the point that we're at right now. And I think we can move into some conversation. Great.
Yeah, thank you all very much for sharing. It's very lovely to hear these stories back to back. I hope you all enjoy hearing presentations. We have 15 minutes to engage in dialogue and we can take questions. So it's my good task to now just facilitate the discussion. I'm looking around the room. Any questions, comments that have been coming up? Yes, please.
I'm Grace Tate, and I've been doing this kind of work for over 30 years now, but I grew up in East America. So I was here before RayCam was built. My family is part of the rich history that we have here. And I think because of all the work that RayCam historically has done, in terms of its grassroots creation of being a RayCam, I think that with the pandemic, it's given us a big disconnect ourselves. and reestablishing our connections because they're very important. No matter how passionate, how feisty as a community feel and get, it's for a reason. It's not just because we're mad and want to stay mad. It's about getting back to the same drawing board where we've had in the past where Dr. Penny Carey was the child advocate for the city of Vancouver, met with parents and heard them. And we often had valuable, creative, innovative ideas that came out of that with places like RayCam and other nonprofit organizations here. And I think that every time I come into a room, including my own organization at the YWCA in Metro Vancouver, is part your agenda outside the door and come here for the common good of the children. Because of all the things that are a mystery and questions for us, we need answers to start helping the children now. The families are struggling in all sorts of ways. Primarily the women, because they're the single parents who are afflicted by this generation after generation. And I think that is always been what we wanted in openness and learning and working together. But if you don't have the same agenda, maybe this is not the time and place for you. You know, there's other pieces of this that hopefully will grow from this because it has grown from this. All the wonderful things that have come from here, we have to get those community members back. We have to get them back. They know it's their rightful place to be here and be the voice. We came out of here as a parent group and we need to get back there again. And 51% and 49% is other. The community has a right to have whatever it sees as important and achievable and wishes and priorities for them, because it has happened here through RayCam and other organizations in the downtown Eastside. And I think we just have to get back to that place and work with who we need to work with, because we did a lot of research. We did a lot of knocking on doors and meeting with politicians and bureaucrats, learning all this stuff and memorizing it and sitting at tables and having these meaningful discussions with other parents all across the city. And it was amazing and it was powerful. It was something that people were inspired because we had a common, it was do it for the kids. We need to get back there because we have been disconnected so much that we don't even know what is going on out there. And that's the scariest part and why these kids are dying. And so we can't wait and sit back one more moment later and we just need to get to it now. And I appreciate the session in terms of having this happen. And I always appreciate RayCam. I said to Kate, you are the leadership. This is the organization for decades. Let's just take it back up and just do what we need to do with who are going to help us. I'm going to take this back to my organization because our CEO needs to be part of this discussion in terms of our advocacy and our role in that. I just wanted to say thank you for all being here today too.
Thank you very much. Thank you very much for sharing. I've heard a lot of things. I do hope that through the work that Rabia mentioned, with the survey, that we will do exactly, if I'm hearing you correctly, do partly this, have these conversations with the parents, with the community members, and you refer to this reiterative cycle, of having these conversations, figuring out, okay, what are the needs, and then what are some of the potentially good solutions to work. So I do feel as if there is an overlap, between what you're saying is the process and with what the group has set out, I'm hoping, and so if not, we'll have to be in that conversation to steer the course, and so I appreciate the comment. Please.
I think, just building on what Grace said and Rabia's request. I mean, tomorrow there's another memorial in both overdose, unfortunately, as Matt is mentioning, and here I think those calls to action, Grace, Rabia, and crew, and all that information coming from Magdalena, and that is that everyone in this room who's coming and thank you for doing this in the community and in the neighborhood
like you all are at different tables and privy to decision making, folks that we are not, and like those things. As Grace was saying, it's so important, and I'm hesitating to use the word allyship, because that's not a good word, but like, how are we accomplices together to like get this work done? And we can see in Rabia's slide, like that complete policy disconnect. We talked about it, you know, the other day, in our sessions, so the grant pieces that we're working on, that it's like the assumption is like that we are doing this for children's good, and no policy in front of that, and we need to change that. And I know both the parents here, the young people here, we're tired of the people, we're tired of not doing the best we can for our kids. It's not okay, and it makes us, we want to be, we have to be accountable to our community members, and not on a regular basis to make sure we are being accountable, as Marie said. So how do we all different, like, activate other folks that work done?
Or only one or two words, and I think one of the words, or one of the phrases that Grace used that I found over the years, it's really hard to do. The more we care, in a sense, the harder it is to leave your agenda at the door. Because it's like you're so well intentioned, and I say you, I mean, we're all so well intentioned, and it is really hard to think, oh, wait a minute, shut up and listen. And ask yourself, with all the best of intentions, who am I listening to? So am I listening to, as both Grace and Kate have said, am I knocking on doors? Am I going to where the people are and saying, hey, listen, this is what we think, or not even what we think. What do you think of this? Why is this happening? Is it happening? So to double check on the assumptions that we all have, because the second, and then I will shut up. The second thing that I think is, I always remind myself of, when I see is what I come ready to see. And that's always a danger to anybody gathering information. And I say that from sort of the research side. It's really hard not to get to see and ask questions that are there because you see them. I'm not sure if I'm making sense, but that is the hardest thing I found in doing research, was to make sure that I was having somebody double check the questions, the assumptions I was asking, because I didn't realize that. So that's it.
Well, may I ask you just quickly, did you find anything useful to overcome that tendency to see what you're trying to see?
Hearing it right now.
Picture analysis.
Yeah, it's one of the things that we have on the critical eye consider on the medicine. Like, for example, when you were going through the list, when Rabia had the criteria for who gets shelter, one of those was actually listed is illegal for the Indigenous community, and it's actually harmful, and it's totally trauma-induced, and it's creating harm and death.
Which
To get childcare. So the one that's under child protection is, it's actually, it's not only trauma-induced and creating harm and death, it's actually illegal. That's a big picture analysis. How many people in this room know that? How many people are willing to say that? And to say it at the tables where supposedly it's supposed to count. Because you get cut off very fast, and you can get cut off of the community very fast. So he's saying something like that. The government, the community, people, funders, decision makers, policy, analysts. I've been doing this for a long time. So.
Yeah, no, I was going to say the other, I do have an advocate that not really in Carwana or Lorelai, but another one, which is my own experience was, if I worked with teenagers, I couldn't help but get better, because they will tell you, lady, and you have to deal with that, and you have to see that, wait a minute, yeah, I guess there's some point to what, but to deal with teenagers and deal with little kids also, you know, while around a semi-tangential example. If you're in a store and you're with somebody using a wheelchair, little kids come up and go, why can't that person walk? And the mother goes, oh my God, oh my God. And it's like, come on, this person is going to give you the real questions because they're not yet societalized, there's no such word, into not saying certain things. So that's the answer. Find people who will tell you the direct answers. I don't know, that's like.
And projections, I was around 5 years when I did the project.
Yeah.
We were part of it, it was the best project I remember. It had been around for a while, we had talked about it, shared it. I remember one time it was set up and it was set up like in rows. And I went like, happened to be there, and I went like this, and I looked down the road, and I went, oh crap, we got an incident that's gonna come down, and said, Tanya, we better get ready. For our young people, like we can see it, and he said, where are you seeing it? And I said, on your slide, they were like up and down like that, and you can see them. I said, oh, it's showing right there, and he says, where? And then I showed him, and then he said, are you using these as predictors? And I said, yeah, are you? And he just kind of looked at me and said, I don't know how you did that. And I said, because it's right there. So sometimes it's just different views of the same information. But it's good to have a variety of people with different views because you're going to get bigger information, like a bigger picture analysis of the information. And then when you can, like I still think, personally, I still think 5 Switzerland's project, if that was still available and was being used as a diagnostic tool as predictors, I still think it would be saving us a lot of the problems we're confronting right now. Because of the warning, 5 Switzerland, the project that was available.
Which project is?
We used it for quite a while for down here and for Tanya and stuff, but it was predictors and stuff.
Yeah.
And stuff. So and the other one is one of the things that crosses my mind, and I'm in a medical background, but I'm not a doctor or a nurse or anything. I'm not professing to be a Western, I won't mean to it. Is that when you look at certain population groups, I'm thinking like one that I belong to in particular, and I think of the COVID, and I think of low oxygen stats and what that does to not only brain function, but to social interaction and overall function. That was one that we needed to look at, and we should have been looking at it, and we should still be looking at as predictable outcomes, especially on our young children, and even up to our teens, because of, advancing them into the school system. If they're not graduating in the next little while, I wonder why. So that's the thing.
I still say that, it's about, we have, sorry, we had
No.
how are we doing with time?
There was a question, there was.
Hi, my name is Guhn, I'm the executive director, so thank you for coming place, and thank you for this, it's wonderful, I thank you for the invitation, I really appreciate it. And just a bit of background, I used to work at research, working with children at risk, and I was lucky enough to come in here and do a workshop with RayCam for some of the students, and I did that for a couple of years, and it was a wonderful experience, so thank you for that too. So the question that I have, and impressive research, by the way, I really like the way that it was presented and some of the challenges that we're facing, because one of the things that we're really interested in is understanding what the effects that COVID has had over the children. We're starting to see it right now. We have a preschool, we also have drop-ins for families, and parents are also asking, what is my child ADHD is, right? But these are just social connections that they didn't have when they're younger, we assume. The other piece that I really liked about this research project is at the end, you went, I still don't know, which is great. There's no answer, right? I mean, it's terrible because there is no answer, but it's great that, we're allowed to have those discussions. So that's wonderful. So the question really is for you as an organization, and I hate to use the expression the dog and pony show. Can this dog and pony show be moved along? And what tables do you want, and what people do you want at those tables so that we can make that happen?
I continue to share with some folks, yesterday to Rabia, we were able to send, one of the last remaining earlier tables, but one of the other impacts COVID and Grace, spoke to it is we lost the connections amongst ourselves as organizations, they're like, Richard from here, some other folks that are in the room from the city of Vancouver and other nonprofits, that we were able, RayCam was in place and the city research from the fact sheet that we all had different components and tables were rolling up that collaborative work together. So there's a pretty good data advocacy interventions and like COVID, that all stopped. Yeah, I mean, RayCam, we kept the center open primarily for childcare, so, and we focused on how are we getting food, how are we dropping off supplies to people if there's emergency. And I still feel like we're gonna be building someone, because that's the other, the impact on the children themselves, or the impact on us as organizations, are like, yeah, how do we use this as catalyst to build that effort together, because we want to do this for the children, and we're all starting with the staffing, infrastructure and funding.
I'd love to hear a response to your question from the academics.
Sorry, say that again.
I'd love to hear a response to your question from the academics, like, how do we make this lack of a better word out when we show, or you discussion, where does it go? How do we?
I do think that, you said we have money for the next table, and you're doing the needs assessment. This should not be a one-off session, it's at the start of the dialogue, Matt is sitting next door. We'll keep collecting the data, but I think what came out of these comments is the question, how do we put these different pieces together over time to actually come up with some meaningful work that affects that and children. So I think it's a matter of finding the resources to make that work sustainably work, to progress. So I already have a long list of ideas of how have sessions with teenagers and children, and you said with the use different words for companionship, or how we so I think it's a matter of being deliberate about organizing these things and not doing it as a one-off, but to keep the eye on the price. And I do hope that with what we're envisioning, where this work will take us, that we're at least giving us a shot of going in that direction at least.
I think because of our, like Lorelai was saying, on our long-term partnerships with health in the past and with other tables that have left, and so a lot of that work has been done. This is just bringing it back again in a 2023, 2024 version. But I think what would be helpful for us and to making it public and to making it official is signing a memorandum of understanding between us. And so that people know it's public and they want to, find out more about this and made it official. These are our roles, and develop some very simple documents to say this is our role, that this is our role in common. I think that's really helpful and will help to build some of that trust back again with the community, because that's what we need to do. To say that, because of all this kind of stuff, we've always had these partnerships. It's just getting back together to figure out where we need to be and where we need to go. And then having these tables start somewhere, and then with all of that input, figure out the strategy where we need to go next.
Thank you.
I was going to comment following up Grace. I think in response to what a few people have been saying, I really nerd out when there's like tensions, like this, I love when two things exist that seem almost incompatible at the same time. And I would say that one of the things that I see in this space is this tension between not even urgency, but like emergency need for action, but then also recognition that doing this in a good way takes time and relationship building. So I think we are in a position of like some fundamental tension there that's important to acknowledge. Like we're trying to accomplish two things that are challenging to do simultaneously, because we want to do it in a good way, which usually means like thoughtfully in time, but these issues are not things that can we can sleep on. So how do we get creative and talk more about that separately? The other thing that I just want to share, that I was working to be in sessions with many of these folks throughout the week, and I think just to a point that Grace made earlier, that like a lot of this work is being done. I think an important thing that we can hopefully do in a time sensitive-ish fashion is like when we have a question, like I have a question about what to do when children are more anxious, there's actually a good chance that Grace was thinking about that in the 90s, and it's somewhere, right? Like it shows that our data governance needs work, right? That like, we don't exactly know where the answer is, apart from thankfully in Grace's head. But we can't, Grace has a lot to do, so we can't be constantly telling me the answer to every question.
They told us not to do that anymore.
And it's all about better anymore. Yeah, so, but I just want to share that I think there's a big opportunity for like looking back, like, and I think as we, again, that's another fundamental tension. We want to look forward and improve, but to do that, maybe we need to look back really well. But I will say that I think, unfortunately, like the thing that's often hard is nobody feels really resourced at the time to do that, like critical work right now, because, you know, I wish I could like geek out and do that all the time, but I have to go be a doctor basically, and you know, and similarly, like everybody has their places that they're accountable to that are pulling us away from that. So it's also like, who do we advocate to? And who are the people that we should be compensating just to do more? It's probably people that are in the community, or it's people that are in the community, but how do we do that together too? That's another hard thing.
I can't help but want to say, maybe, and I like what you're saying about the tension between it, I mean, I know that we don't have time out there saying that have resources, but if you just thought about while you are doing the role you're doing, so as a doctor, you have all kinds of information in front of you that isn't just that person's got a sore toe in front of me by simplifying of your role, but and you know, others of us may have opportunity to hang around. Hanging around is really useful. Not everybody can hang around. So those who are able to hang around, please hang around because you get other information that people who are more focused will not get. And then we connect all of those different people together. We will begin to get the full sort of mountain that Piaget's kids saw, right? They were all sitting from different sides. If they had all gotten together and said, I saw it in the answer, why didn't you know? Why didn't you know? Here, blah, blah, blah. That kind of thing also can take part in a more comfortable social situation where you just chat and you're talking about exchange. Anyway, please stop me.
I stop you. I can sit here all night, but no, this is good.
I like that idea, if we had a place to put it, some of the information to go into something that you could just have different information coming in, but if somebody has to be able to process that.
Well, and even I'll say, like, for what it's worth, a lot of the information, so these folks maybe didn't make it clear, like 5 persons called and proteges, right? Like they're, and a lot of that information is actually sitting publicly on their website and can be accessed. And so it's just like, how do we just find another time to come back and share how to do that in a meaningful way to, you know, fill in the gaps, right? But that's easy-ish, right? And look at the knowledge action team.
And it's just, it's important because a lot of times it's sort of, it's a footnote, but it's not, you know, utilized anymore, but it's still, for a lot of us, we utilize it, it's still important. It's a process that we can gauge what's going to, like it's a predictor. And once we know that, we show other people how that happens, then they go, oh, okay, and then it's not on the back burner anymore. That's what it is. Right, so there's information from the past that might be useful today, but somebody else not being, I'm not attempting. So somebody else has to get the information and be able to put it somewhere and then make it useful so that people can sort of read it and understand it and apply it, right? That would be great, it saves us the job.
So again, just to, so push off the point that I was making earlier, is there a possibility to take this show on? And in my head, I already have one committee that we're part of, which is the early childhood development through WASA, and then we also have another family places, which is funded by NCFP, and NCFP is very interested in having some of these conversations that everybody in there is an executive director, so they have connections and they have full do some, bit of advocacy and perhaps pull some extra information out of that and be really curious about where that data comes from and how does it fit within the community. Also, I'm part of South Vancouver, where we're really sort of pushing for services in South Vancouver. It's a huge community, only 2 organizations, well, 4, but in like the span of, from here to Montreal, right? Like, so, and we're really advocating for that, and one of those pieces that we're advocating is the children are the ones that are losing in the school, right? So this comes at a really good time to have that. So perhaps you and I can have those conversations with the youth. Yeah, I'm very excited for that. For WASA and then also for we could also invite the MCFP people in there. So that would be wonderful. And again, we all sit in these committees and often I get frustrated in some of these committees that you sit in because it's like, oh, this is what we're doing, this is what we're doing, this is what we're doing. By the end of the day, you're done, right? So this could be a place where we can pressure some of these communities to decide what, because we can't have whatever, but certainly what can we push off of, and then start doing that.
And that's actually the MRU.
Yes, that's
like, okay,
fantastic.
Yeah.
Yeah, and if anything you know about me is that I'm really action oriented, I don't like to sit there and pretend that I can take space. So yeah, and so let's start with the WASA one, and see if because I think there's one coming up. Well, it may not happen until January.
Yeah, so we like that table with the surface ratio and family places where we're kind of every year. And we brought up the fact that we're doing this to share that, but also our needs assessment, as Rabia mentioned, and how are we how are we using evidence to further advocacy, or to your point from the history, and we pre-COVID didn't have success. We had a whole full day at the library, advocates, folks in this room and others, putting that data, presenting, and about like other folks here, like sharing what we had done and call to action. Yeah,
that's right. And through this data, there's funding and opportunities and all that stuff. So, yeah. So there you go.
The show could be on the road.
Okay.
So the Magdalena Janus.
Oh.
I'm here every now and then. Yeah.
Just before I'll take your comment, so, but we'll make sure that we're gonna be pragmatic about, following up.
Right, we have Zoom, we have
the connection.
I'm very curious as to why the children in BC are more vulnerable and the teachers are significantly less concerned. That's not even a marginal lesson.
They had the same reaction. I'm not sure if anybody has a good.
Well, I think just one caution is that, all the other provinces were mushed together. So, that the difference was a little exaggerated. Okay. And a lot of that happens also at the neighborhood and school level. So one, we were trying to fit into our kind of respective slots, but what, that one number of vulnerability for the whole province or bunch of provinces is important, but it's way less meaningful than the differences between schools, between neighborhoods. And for our data for all of Canada, we have the variation from 0% of children who are vulnerable to 100%. And it happens actually in almost, like in some provinces, the lowest would be 0 would be 2.6 or something. But we have the variation everywhere. And, when we were talking among ourselves, we knew that somebody was going to ask your question and we was like, what are we going to say? Well, we're still kind of puzzling that over. But what I'm just going to say that, yes, that is a big difference, but actually within each of the province, there are big disparities.
And even within the city, because Strathcona is over the 20 years CDI has been collected, Strathcona comes up twice high, like 2 times the Vancouver average in vulnerability. But if you were to just look at the vulnerability and the teachers in Strathcona, maybe the difference wouldn't be that high. I say only from anecdotal experience, working with our elementary school teachers in Strath and Seymour. So I think with that reiterative dance happens both at a macro and micro level at every single, like, is the macro as applicable to the micro picture? Sometimes yes, and sometimes no.
And, just one thing that I'll say here, because it's very much a policy issue, is that, Ontario, even though there's quite a bit of disadvantage there, like Toronto areas are very similar to some of it. We do have, like, there is an additional earlier year of publicly available, publicly paid kindergarten. So majority of children, 90% of children go to school at 4 years of age and get at least those 5 hours. And we don't know for sure. This is a little bit anecdotal kind of brainstorming evidence, but it potentially is one of the possible equalizers in terms of that investment in additional year.
Well, that depends if we believe institutionalizing children is the best, unfortunately.
I think that's the environment question. I wouldn't say that, necessarily going to school is institutionalizing, but there is a certain amount of, equalizing influence, right? So I'm totally open to discussion. Sorry?
It depends.
Yeah.
It depends what you're doing within the school system.
Yeah.
With the,
Yeah. And I mean, childcare also now, like daycare, $10 a day, we're part of this education in childcare, so I think we also need to think about what is like $10 a day is funded through the Ministry of Education and Childcare, so we can't excuse ourselves from creating an institution. On the other hand, for those of you who walked in from that playground that was dug up, right? And when it comes to environment, our playground becomes more important. Oh, there you go. I didn't even realize I was doing the promo for your next time. But an environment matters, because where else will kids in this neighborhood be able to undertake risky play, which he can probably tell you way better than I could, is important for development, right? Just access to open spaces, access to hot meals that are informed by nutritional guidelines, and things like that. So yeah, the word, these would have said it, like the accountability lies within our culture. And that was the promo. Now you owe me.
Very good. Well, as I mentioned, to add my 2 cents to your question about the differences between provinces, and particularly BC. One of the things that's limiting for us is that even across Canada over the last 20 years, we only have about 35 to 40 different kind of data points. In BC we have 7, which is great, and Manitoba has a lot, but some provinces only have a few. So we're a little low on data, but what we had looked at, I think housing affordability is a big issue for British Columbia, having a higher vulnerability rate, say compared to Ontario, where there's also a housing affordability, but a better system in terms of more low cost or free early childhood education earlier on for everybody when kids are 4 years old. And so we look at things like GDP per capita and labor force participation of women, income inequality, and all those things are factors that come into play that make that turn out that BC has a higher level. Plus, I think everybody at BC is just different.
Is that a paper? Heading up a paper there. Different.
We're working on some of these questions.
Well, I think you just highlighted it's just the lens. We can look at it as education, we can look at it as a bigger scope of the housing issue and then the food security issue. It's all the lenses, like we were saying, it's all the lenses that you bring to it. And you may come in with your own lens or something else's lens. But when we look at it, it's a systemic issue. It's not ever one thing. And so what you're saying is here at RayCam, there's a lens in Marvel, there's a lens in something, there's a lens. And so it's all the pieces. And so the more voices you have to the table, the more lenses you have, the bigger conversations. Maybe with or without solutions, but the bigger the conversation is. But even in that process, there's more understanding components within the conversation after.
We asked someone earlier, this community organization, I saw this thing, wait for it.
No.
My wife does that.
We both work at Panelists,
Yeah.
but we're both in South Vancouver.
Okay.
Yeah, we're part of client time, basically.
Yeah. I think, I mean, that was a bit of a common thread, when you mentioned the children and the teenagers, you said different methods, you know, depending on who is sitting at the table, you have to do conversation. Well, I think that's one of the themes that we need to carry forward. I think with Rabia mentioned with the survey, you know, ask the parents what means, you know, what is support that is useful. The more people you have at that table, the more perspectives you'll get, and you will also identify certain like that run across. So, you know, there's so yeah, I think we are what an hour beyond our time. I was to say order food and drinks and those things, so they turn on all the lights. We do, I think we do have time to mingle around the so please stay and talk and follow up. Maybe we'll call it, it's not really that formal, but so maybe we'll call close to this semi-formal part and go completely informal now. I do want to thank everybody for presenting, preparing, setting up, getting the funds to do this, especially for you to come doing, you know, whether it's 4 hours or out of interest and bring this energy to the room. I certainly walk away with a long list of ideas, and I hope we get to do the roadshow. That's part of my plan for so thanks again. Thank you very much.